I'm doing amazing.
Likewise,
I'll have to
likewise.
admit,
How are
I'm
you?
so excited and nervous to be talking to you. Good nervous, though. Very excited. I mean, your work was a huge influence in my work. So I just want to say thank you, and I'm very grateful to be here.
No, the pleasure's all mine, and I appreciate the work that you do. I've been watching you and following you from afar for the last few years. And yeah, just want to first obviously commend you, congratulate you for your work that you're doing. I just want to obviously help people to share the little that I know and help connect people that may be following me to kind of understand and appreciate the great work that you're doing. So
Thank you. And I
definitely
have your
kudos and
book
hats
right
off to
here.
you.
I have to say this was
So
thank you. And I
definitely
have your
kudos and
book
hats
right
off to
here.
you.
I have to say this was the one that started it all. So I recommend this book often, and just what you compiled, what the work that you do as a scholar and writer, it's amazing. I mean, I had a lot of trouble finding these resources. Actually, a lot of the ones you quoted in your book, I was saying, this is it. There's got to be more. There has to be something else out here that has a different perspective on sexuality. So I'm glad that you kind of gave us those resources.
No, thank you very much. And again, I'm glad that there's people like you who are actually bringing the work that I'm doing and other people's work to life, because it's all well and good writing things and researching it, but it's important that there's people in the field, people like yourself, who are not only, just going through your website and I'm just going through your education and training, and I think you're probably the most accomplished person I've come across, because it's just mind-blowing the amount of qualification that you've managed to obtain. So again, I think that's even that in of itself is definitely inspiring, and it shows that we definitely do have many people, both within the Muslim community and obviously women at large, that are kind of doing great things. So definitely, again, like I said, yeah, I mean, it's not for me to say, but yeah, definitely keep it up. And I'm just really pleased to kind of be speaking with you. And again, I want to hear a little bit more about your career. So before we start, do you mind giving a quick elevator pitch introduction
Yes,
to who
I'm a
you are and the work
psychologist
that
and
you
sex
do?
therapist. I mentioned both in my title because they're different. Psychology, as a researcher, I do testing. I do things that really help people understand their mind, their behavior, their backgrounds, their early experiences. A lot of my work as a psychologist focuses on attachment theory, which really helped shape my research around love addiction, which I'm excited to talk about because people always have questions about it. And then sex therapy is also a different kind of branch of psychotherapy. It's education, it's coaching, it's holding space for people around how to understand their sexuality, and then using what I know as a psychologist to help create a therapeutic space for people to heal from sexual issues. Because my theory is we all have sexual issues. So in my opinion, everyone needs a little bit of sex therapy. So I love being able to do both in my work. I have a private practice, so I offer coaching, therapy groups. I was actually just talking to one of my associates. We're planning on doing retreats and bigger kind of outreaches to get people different opportunities for healing. Not everyone is going to go to therapy. Not everyone has the resources in their communities to do therapy or couples work. So I want to have different opportunities to reach people. And I love that we have technology like we're doing now, so you can talk to people all over the world. And that has been an advantage I've had in my work by doing media and talking to people like yourself and getting my research out there, is that I'm able to meet people from all walks of life around the world who say, I don't have anything in my community, or my doctors are not talking about this, or how do I heal when I don't have I don't know where to start. I mean, that's probably the thing I hear the most from people. Where do I start? What do I do? I really need some guidance in that process. So that's a lot of my work too. I consult, I work with companies around sexual wellness. Any way I can talk about sexuality and get it out there, a different message, a sex positive message. That's really what I think I'm here to do.
What are some of the common sex myths, shall we say, especially in relation to women,
There's
that you come
definitely
across
a
that
lot
you
of
try
myths
to debunk?
around kind of your control over your pleasure, permission to have pleasure. I think women, especially from conservative backgrounds, have heard a lot of mixed messaging around sort of the secondary nature of their sexual pleasure, that it's really about pleasing others, or that pleasure is really about a different experience or a different role in your identity, whether it's, we're creating a family, or, it hasn't really been pleasure focused. There hasn't been a lot of permission around knowing your body, having a good relationship with your body, even touching or looking at your body. So I feel like because of those mixed messages, whether it's if I do that, I'm going to be perceived in a negative way, or I won't be able to have control over that experience. I find that there's just a lot of myths around what's normal, what's right, what's okay, and am I okay because I have these thoughts or these feelings or these fantasies around sex. So that's a common issue I see. A lot of shame, a lot of embarrassment, a lot of fear around sex, and not a great relationship with pleasure as a whole. And that's really a focus in my practice. Is absolutely, we're looking at sexuality, but just your relationship to pleasure. Humans are natural pleasure seekers. So when I meet with a client from a conservative background, I want to know about their sex history or their sexual conditioning, but I also want to know, what is their relationship with pleasure? What makes them feel good? That is really what drives us and motivates us on so many levels in our life, biologically, psychologically, is our seeking to feel good. We want to have experiences to feel good. And so I find that that is a major conflict that women come in with. Sex doesn't feel good. It may hurt. It may feel shameful. I don't know how to communicate what I like or want. I don't feel comfortable in my body. So these are very common issues I see with women of all ages and stages of life. So there are just a lot of similarities, even outside of conservative communities. I think we all share similar experiences, which is why I like working with conservative populations, because they can sometimes feel very isolated and different from other cultures, but yet very similar issues, very similar concerns.
Right. Amazing. And again, I was just looking on your website and I
Yes.
came across I think it's a mind body approach to sexual pleasure enhancement. Can you talk a little bit about that
Yes,
and
when I was doing my
what
training,
that's
I
all
found that
about?
there was kind of something missing in psychotherapy in terms of how we were dealing with sexual concerns. I thought that we kind of hit an end of the road when you're doing the processing or talking through or working with belief systems. It was the relationship with the body that was missing. So I created kind of a model to look at how all of these factors play in together. So mind body approach means we're looking at how what we learn and what we think about sex does affect our body, our physiological response, our nervous system, and helping people understand the somatic role of sex. Because what's more body-based than sex? I mean, sex is very much about our mind, body, heart, and spirit experience. So I wanted people to understand that, sex isn't just this thing we do. It's an experience we create. It's an energy release. It's connection. And so by having this model, I think it helps people expand their own definition of sex. And to say, oh, okay, so enjoying aesthetic beauty with a partner can be pleasure, or, erotic is much more than just what we're doing mechanically with our bodies. So this approach has helped me assess differently when it comes to gathering information from clients about sexuality, and then also creating a treatment model that isn't just talk therapy and kind of processing what has gone on and looking at it more in terms of a behavioral model, but more of a holistic, as in whole body, whole person model around sexuality. And it's empowering. I find that mind body approach gives you a lot more tools, a lot more awareness around how sexuality works, rather than just having constructs or schemas of, okay, this is what sex or love should look like. So I love the mind body approach. I love the movement that I think our culture is in right now around wanting more wellness and mindfulness and ways to connect on a deeper level to our bodies and minds. So it just fits in perfectly with sexuality. I can't think of a better fit than mindfulness, mind body work, and sexuality.
So you're a certified clinical sexologist, a professional sex coach, and also a certified sex therapist. What is the difference between the three, a
Yes, great
therapist, a
question.
coach, and a
And it's a
sexologist?
lot different training, but they all really have a different approach. So sexology really comes from the scientific background of why we do things sexually and how. So looking at behaviors and the understanding of our sexual behavior. So I use a lot of my sexological training for education to help people have good resources and tools. So there's a lot of education I use with sexological approaches, from everything from how to assess, with how to help clients understand, self-examination of their bodies and understanding physiological and biological things that we do sexually that are really our kind of primal instincts. And then sex coaching kind of works with that and offers a more solution-focused approach to working with sexual concerns. Because many clients come in, they're very high functioning, they may not have mental health issues, and they're just really looking for tips and tools. I want some books to read, or I want to know about products, or I'm curious about vibrators, but I'm not really sure. Where do I start? So I find sex coaching to be a great alternative to therapy, because we really start with the current. What's going on now? What can we do to provide some good resources and get you excited about sex? That could be going on a field trip to a store where you're buying some products, or actually doing demonstrations. What I love about sex coaching is I have a lot of tools. I have devices I'll bring out. I have vulva puppets and things that I'll use to help people understand concepts in sexuality. And then therapy is the type of approach where we're doing talk therapy, we're processing, but we're really looking at all aspects of that person, their identity, their values, their culture, their early life. And this is where my psychodynamic work comes in. I want to know about early relationships, traumas, things that have gone on that really shaped who that person is sexually. And it helps me understand a bit more about their ways of thinking and things that actually maybe where they're stuck in their life. So very different. I always tell people not everyone needs therapy when it comes to sexual issues. And that's why, assessing and really looking at what the concern is and giving someone a space to be able to address some of these issues, they, determine which one of those approaches or modalities works best. And to be honest, I kind of use a combination of those when I work with clients. We'll do a little bit of therapy and coaching, and in most of my cases, working with sexual issues. Addiction, it's not actually an addiction. I mean, addiction can be very subjective as to how you define it. I mean, if we're looking at it in terms of a chemical addiction, it is definitely not that. But that was my question going into this research. What is it? Who gets it? Can we really be addicted to love? And so my definition is that love addiction is a unconscious habit that forms as a way to meet an unfulfilled need. And usually that stems from early attachment wounding. So that can be, I'm using sex or relationships, and love addiction, by the way, can be 3 different subcategories. You can have sexual out of control compulsive behaviors, relationship dependency, or actually feel a sort of drive towards love, the experience of love, passion, romance, sort of the fantasy of that can become the compulsion in the relationship. So I saw it as more of this unconscious drive. And I also saw a major component in early attachment and working models of sex and love that leads to maybe, distortions in how people are seeing that in their own modeling of relationships. So for example, if you had a model of love always being something that was risky or, dangerous or difficult to obtain, that's a working model that you may bring into relationships. Maybe it creates avoidant attachment or difficulty opening up because it's too vulnerable and overwhelming. So I really found love addiction to be something that, yes, it can exist, but I don't use the word addiction. I look at it as more of maybe an out of control or a behavior that has now become something that isn't providing you with comfort, but instead activating a lot of distress. I think people think of sex and love addiction as something that, people are getting a lot of this euphoria or feeling of intensity, and that it's something pleasurable. But for many people that experience this, it's actually a very cyclic experience, a very short-lived pleasure that then activates a lot of shame, a lot of guilt, a lot of isolation, a lot of depression and anxiety. So I was fascinated by it. I was working in an industry, you know, kind of the mid-late 2000s where it was all over the place. I mean, you couldn't read a newspaper without reading about sex addiction. And in working with clients and couples, I found that they were saying most men are sex addicts, but women are love addicts. And I thought, why is that? Why are women looked at as love addicts? Can women be sex addicts as well? I mean, what is all of this? And so I started diving into books like Women Who Love Too Much and Leaving the Enchanted Forest and all of these sort of ideas of how we see love addiction as something that can be very socially constructed. And that was a lot of the work I was doing as I provided my research, is that, you know, yes, of course we can become consumed by love. Anything we do in our life can claim our consciousness, and love is powerful. I mean, if we think about it, it's our first emotion. It's universal. I mean, everyone knows love. Even animals experience love. So it's a powerful, powerful emotion. But if you ask maybe a group of 100 people, I imagine everyone would have a different definition of what love actually is. And I saw that even in my field of psychology. I mean, there are so many variations of how people define love, how we measure love, what are healthy sort of models of love. So it was all over the place. So when I was doing my research around love addiction, I found that there really is a lot of work to be done in understanding, you know, love and love behavior, but fascinating in terms of how we understand our own behavior and also the relationship and sexuality in love. I mean, that kind of gets crossed in our learning around what is, you know, what do we really value, and how do we experience connection? You know, is love necessary for us to have sex, or is sex necessary for us to have love? So there's just sort of a lot of, again, mixed messaging and social conditioning around how we view love.
And in your field with experts like yourself, is there more of an acceptance or pushback with like the love addiction term compared to the sex addiction term? Because I understand that the sex addiction hasn't been admitted into the DSM
Right.
as of yet. It's sexual compulsive behavior. I'm just wondering what's the stance towards
It's
like
the
love
same
addiction
sort of divide. I would say
from
there's sort of
experts.
a side of the field that says, absolutely, here's sort of the way we view it and models in which that support it as sort of a compulsive addictive behavior. And then the other side says, absolutely not. I would say sort of that middle ground and understanding in terms of how clinicians view it is that it can be an out of control behavior, but we treat it more as something that is not as negatively viewed or perceived as something, you know, completely out of your control. I think the out of control sex and love model looks at it more as understanding it as sort of something that underlies, is driven by anxiety or early traumas, and has a bit more of a healthy sexuality model attached to that treatment. That was something I was seeing lacking in particularly the sex addiction model. There was a lot of, you know, adaptation to the sort of addiction, chemical addiction model of, you know, doing 12-step programs and sort of admitting this powerlessness over, you know, love and sex. And even though I see some value in that model, it was really missing the piece of healthy sexuality. You know, if we're abstaining from all things sexuality, how do we integrate that back into our life in a healthy way? So that was what really prompted my research. Does it exist? How do we work with it? And how can we give clinicians a better tool or resource on how to work with clients rather than just kind of abstaining from everything and creating more shame, which perpetuated the cycle in the first place, and giving them an understanding and accountability for their sexual and, you know, love behaviors that may just not be working for them. So language is really important, and also, you know, that providing that healthy sexuality model were really important in terms of how I work with sex and love addiction, as I put them in quotes, because whatever we call it, you know, I'm less concerned about what we call it and more about the experience that the individual has. And I find that most clients self-identify because they've read that and they've maybe taken an assessment online, 10 questions that says, yes, yes, yes. Okay, I must be a sex or love addict. And so there's so much confusion again around, you know, identifying as this thing that I have that makes me again feel powerless and broken, and that something's wrong with me, that if anything, I believe just creates a secondary trauma if we don't treat it properly.
How does curving the language around actual sexual dysfunction truly address people's genuine concern
Yes,
that
great
something is
question. You know, I
functionally
think
wrong?
language, if anything, the power of language is that it can normalize and stigmatize, but not always in a good way. So if we're using terms like dysfunction and using a very medical model to work with sexual issues, let's say that treatment doesn't work. And now you're thinking, all right, I had this issue. This was the way that I was taught or that I learned to address it. And now it's not working for me. It really doesn't move you anywhere closer to where you want to be around feeling more sexually empowered or in control. So language is important. And it's also important to remember that sexuality is subjective. So what I try to do is not kind of bring in all of these clinical terms and phrases and overwhelm, because let's face it, they're not the most friendly words in our sexuality. I mean, for example, hypoactive sexual desire disorder. What sounds scarier than that to describe something that I imagine almost every human being has dealt with at some point in their life? So that's an example. You know, is it important to use that term to help someone understand that they have low desire? To me, not necessarily. I may kind of give information and share how we look at that clinically, but I also kind of broaden that to normalize that, yes, low sexual desire is a part of sexuality, even healthy sexuality, you know, healthy in whatever way you view that. So what I try to do is build the rapport and understand your language. How do you view sex? What do you call your genitals? How do you refer to your low desire? Do you actually say that? I have low sexual desire. I mean, some people say low libido. What does that really mean? We hear libido, desire. What's the difference? I mean, there's so much mixed language. And sometimes I'll meet someone and they'll have read so much and there's all this language, and I'll say, what does that mean to you? Is that how you feel? And they'll say, no, that's what I thought this is. And so it feels even more isolating. So I'll use the client's language. I'll be curious about that. Even in my assessments, I have a lot of space where a new client can fill in their own information. I like to hear their story in their words. What do they use to refer to that? How do they refer to even their early education and history? So that's kind of my view on using the language. Now, for an individual who says this is important because that, for example, if I have vaginismus, that may be important for me to understand, there's actually a name to this. And so it helps me understand this condition I've been dealing with maybe all my sexual life. And so that gives me a sense of relief, knowing that I'm not the issue. There's something here that I'm going through that is also something that people experience. So it really varies case by case, but I think in general, I really try to open people up to expanding how they use that language so they can help, again, feel more empowered and not so broken around sexual issues, like I said, that are just so common.
I'd like to ask you a little bit about your research, which you
Yes.
presented in 2017, Islam and Sexuality by 2 Latin American converts in the US. Can you talk a little bit about that, and what was your key findings, or what was the response from the other sex educators and sex therapists?
My research began actually when I converted myself to Islam. We had moved back to Los Angeles and was looking for a community, and found a community in South Central LA. That was my community. Shout out to Islam Academy. They are the wonderful community that was so welcoming of me. And it was interesting as a sex therapist, when I went into that community as a newly Muslim woman, I was so embarrassed to share that I was a sex therapist. I will admit that. I didn't know how the community would accept me. And what I found in this community is there was a lot of openness and curiosity and desire for education. So I started doing groups at my mosque and started doing sexual health workshops. So it really created this need and niche. And when I found that there's not, from the community and from other communities that I then reached out to, is that no one's interested or offering sex education for these women. So that's what started the research. And then I have my wonderful colleague, Nia, who was part of my research, who was also working in communities as a Latin American convert. And so we joined forces and said, let's create something that we can then take and offer to different communities, and even have communities offer for their communities, and co-facilitate this space for women to learn about sex. And that's really how it began. And so we did everything from surveys just to get general information on what are the topics. Because I'll be honest, when I did my first group, it was just kind of a, let's go for it and see how it goes. We had women from 17 to 71. And the biggest feedback I got was, we probably need to separate this out into different issues for different age groups, especially conservative women, obviously, that are pre-marriage and haven't quite sort of stepped into what those sexual needs may be. So that's really what began the research. And it was so healing for me too as a convert, because I come from a Catholic background, and going into Islam and sort of understanding, you know, how do I communicate about these topics? What is acceptable? What are the things that people learn? And again, language and all of that information, which, by the way, your book helped me a lot with interpretation of, again, what some of these texts and scholars have said over years and years, and understanding pleasure from an Islamic perspective. So that was part of why I felt it was important to do this research. So presenting it at the World Association of Sexology was wonderful. We got really great positive reception and a lot of support, and that felt great. Again, a community that not a lot of people are reaching out to, or maybe don't know how to broach the subject of sexuality, and just kind of going in there. And my model was an integrated model. So it was also about, it's not just talking about it, but really the whole mind-body approach. How can we teach women about sexuality in not only a fun way, an informative way, but from, you know, again, mind, body, heart, and soul? How do we bring that into our understanding of sexuality and make it a little bit of fun at the same time?
Amazing. And I loved what you said. I read the abstract about of that paper where you mentioned you believe it's essential for sex therapists to understand the culture and religion of their clients, and to provide them with a safe environment to explore their needs. Yeah, that's amazing. Is that something that you've come across? That I'm just wondering, are many therapists taught about the importance of culture and religion of their clients in terms of having empathy and understanding how that may impact their
Not
understanding
enough.
of,
I mean,
of
it's kind of
sex
like
and
sexuality
sexuality?
education. They may get one course on, you know, multicultural counseling and cultural issues. Not enough, because I hear so many stories of clients that may have, you know, a therapist made a passive comment or made them feel unsafe or created a little bit of shame or challenged their beliefs, especially around sexuality. I've had many conservative clients come in and say, I wanted to cancel this appointment because I thought, if anything, you were going to make me do something I didn't want to do or change my beliefs around something. So I found it was really important to make someone feel that their beliefs were understood. And even if I don't know much about that background, to be curious about it, because religion has been such a big part of my work. My first sex addiction clinic, we had a very large Orthodox Jewish population in terms of treatment. I worked in a clinic that was primarily Mormon women and couples. And so again, it's important for us as clinicians to say, how can I work with this and understand and be curious about this culture, so we can blend that into healthy sexuality in a way that makes sense for this individual, without creating, again, normalizing it or imposing models that may turn people off to sexuality, but instead help them embrace it at their pace in a way that feels aligned with who they are in their cultural and spiritual beliefs. So that's really important. And I wish there were more training. I mean, I hope that even this discussion may help us to kind of think of, how do we help clinicians? I do a lot of education for clinicians around sex therapy, sexology, clinical sexology, but I really do believe that cultural and religious piece is missing from our training and field, unfortunately.
Letting people know where they can contact you. You know, this is your sales pitch. Please plug in anything that you've got going, any kind of, all your
Yes,
services, or where people
absolutely.
can find
Absolutely.
can
All
find you,
social
please,
media
let people know.
platforms at Dr. Shannon Chavez, and my website, drshannonchavez.com, and my practice is shapecenter.org. So that's where you can get information about my practice and my team of clinicians and what we do and all of our expertise. So please, I also offer a complimentary phone consult. So if people are kind of curious, is coaching for me? Should I do sex therapy? We offer a phone consult to kind of direct you to what might be a good service or to help you find one in your area. I also have many colleagues and a great network. So if we can't help you, we will definitely help you find someone who can. So yes, thank you again. I mean, I'm
Amazing.
such a fan of yours, and
Amazing.
this is such an honor. And anytime you want to talk about sexuality and
No,
religion, I'm here.